video will show you how to appropriately set up, maintain, and troubleshoot drainage of CSF and monitoring of ICP with Integra AccuDrain External Ventricular Drain Set. Supplies for this simulation include the AccuDrain, sterile preservative-free saline, Integra or Codman catheter, cranial access kit, external transducer as needed, and PPE including sterile gloves and a mask.
Mask not pictured.
After gathering your equipment and performing hand hygiene, you will secure the panel mount to the pole.
To secure it to the pole, you would hang it using this string. Then on the main body of the pole, you would squeeze this lever and these two clamps would adhere to the pole. Then for the final securement, you would pull the straps over to fit within the levers. Nothing else should be on the pole. The pole should be a free pole by the patient's bedside.
The AccuDrain system works on the principles of gravity with zeroing to an external landmark. Ensuring the AccuDrain is properly secure may prevent the drain from falling below the external landmark and resulting in excessive CSF removal from the patient.
For simulation reasons, the pole will not be pictured here.
With nothing else placed on the pole with the drainage system, this allows for free upward and downward movement of the AccuDrain to accommodate when the patient repositions. Your next step will be to prime your tubing. Prior to priming tubing, you will place mask on face and don sterile gloves to preserve aseptic technique. Then prime tubing from the pressure transducer stopcock, first toward the patient, and then toward and all the way to the burette. Tubing must be primed with preservative-free saline to avoid any reactions with contact with the CSF. Once your tubing is primed, you will inspect line for air bubbles and debris. Air bubbles in the system will result in inaccurate readings of ICP measurements.
If air bubbles are found, continue priming system till all air bubbles are out. Place a red cap on the port used once priming is complete. If system is needing an A-line, the A-line can be removed. The transducer can be removed from the, if an A-line is needing to be used, if a transducer is needing to be used, it can be removed from the A-line system and applied directly to the EVD system. This point would be right here. The transducer would need to be primed prior to connecting to the EVD point. For leveling the drain, it needs to be level with the tragus of the ear, or if it is a lumbar drain, the umbilicus. To zero the drain or level it, you always want to make sure you're using an improved device. Eyeballing is never accurate. You can either use a string level or a laser level. These should be stored in the supply room or come packaged in the kit. When zeroing the line, if you did have a transducer, the transducer itself would be turned off to the system to 0. If troubleshooting is needed because output has decreased, the first thing you would do would be to lower the system below the level of the patient and see if output increases. If this does not work, then you would need to gather supplies for additional troubleshooting. You would gather a sterile towel, sterile gloves, a mask, a sterile syringe, saline, and betadine. You would lay this portion on the sterile towel. You would don your sterile gloves and your mask. You would then proceed to clean your site with betadine. You would turn the stopcock off to the system, attach your sterile syringe, and slowly aspirate 2 cc's of CSF off the patient. Then you would turn this off to the site, attach your saline syringe here, turn it off to the patient, and you would flush away from the patient. You should never flush towards the patient. If all of these measures do not help the drain to become patent, you would contact the neurosurgeon for further instructions. If you are obtaining a patient sample, you would use this port above. You would grab a sterile towel, betadine, a sterile syringe, and again don sterile gloves and a mask. You would lay this on your sterile site, clean with betadine, clamp above, and slowly aspirate off 2 cc's of CSF from your patient. This would be placed in a sterile CSF tube and walked down to lab. CSF should never be tubed.